We have, as of today, 6th October 2024, registered a total of 12,704,548 members into the Social Health Authority.
Hundreds of Kenyans have had to pay from their pockets to access critical services such as dialysis during the migration from NHIF to SHIF. And following the outcry of patients, the Social Health Authority has committed to refund those who spent their money.
An example was Amze, who actually cried on the TV, and immediately we got that. Actually, we followed up with the patient. The patient, by the name James Ngaruya Kanyore, was a patient from Nakuru who went to a hospital called Sublime Hospital in Nakuru town, in Kenyatta Avenue, and he could not access service the first day he went there. We followed up with the patient. We actually talked to the patient ourselves, talked to the son, who was the caretaker, and actually followed up and made sure that in the next session, he will not going to go through any problem. The next session, his next session will going to be tomorrow on Monday, and we have also agreed that we are refunding the 9,500 that was paid by him to the facility. We also got another patient from Mombasa Coast General Hospital, who raised some issue, and we also followed up with the patient and made sure that the next session that he has, which is chemo, which is also tomorrow, will be taken care of.
All patients who have paid out of pocket reach out to us, and we will do the same for them. All the patients who have paid out of pocket.
This comes even as all SHA beneficiaries have been called upon to ensure they onboard their dependents to enable them access services in the 1,442 contracted health facilities.
All public hospitals level 2 to 6 have been contracted and are offering services to SHA registered beneficiaries. With regard to private and faith-based health facilities, as of today, 6th October 2024, a total of 1,442 health facilities have since returned duly signed contracts and are therefore offering services to SHA registered beneficiaries.
So far, pending bills owed to facilities have been a major challenge, which the ministry has vowed to fast-track to enable service delivery to Kenyans.
How are we going as a government to continue supporting them and meeting our obligations, payments of the outstanding bills? We realize that has been one of the biggest challenges because the service providers, their resources are now dwindling and they are not able to cope with additional members of the public who want to seek service within their facilities. We are going to fast-track as a government payments of the pending bills. And to help us do that, we have formed a committee under my leadership, which will then quickly move and clear any pending bills so that we are able to support them. This is going to be sustainable for them in their service delivery.
I am calling upon the state agencies which owe money to the defunct NHIF. Without any further delay, release those funds. We as providers are ready to cooperate, but we will cooperate when we have the money as well, because it is necessary for the provision of services.
To this end, the NHIF system will still be in operation even as the authority works on the e-claim system that will be available to all within the next 24 hours.
We have also made sure that the health insurance claim system, HICS, operating under the defunct NHIF, continues to be in operation for member verification, discharge of patients admitted before 1st October 2024, and for claims management. We have agreed the healthcare providers that a joint committee chaired by the Principal Secretary, State Department for Medical Service, shall be constituted to undertake verification of all pending bills incurred under the defunct NHIF. Further, we have committed to the healthcare providers to prioritize the bills during the transition period, which is from 1st October 2024. As a result, there shall be frequent consultation with all healthcare providers.
It remains open, and you can continue to use it to verify clients before you offer service.
This comes in a bid for the ministry to ensure universal health coverage to all Kenyans.
Our delivery of UHC is premised on digitization. The private sector had done quite a lot in terms of digitization, and we are very happy with that. We are only integrating into the system. We had challenges because the systems could not speak to each other, and today our technical teams have worked with them.
Robbie Omondi, K24.